Thank you for the opportunity to present our research. My name is Jessica Sun, and I'm a third-year resident at the Cleveland Clinic. Our project is entitled Factors Associated with Successful Same-Day Discharge in Patients Undergoing Minimally Invasive Hysterectomy for Endometrial Neoplasia. Minimally invasive surgery is the preferred approach to hysterectomy for many indications. Minimally invasive hysterectomy, compared with traditional laparotomy, is associated with lower blood loss, better pain control, fewer postoperative adverse events, earlier return to full activity, and higher patient satisfaction, which persists in quality of life measures 6 weeks postoperatively. An added advantage of minimally invasive hysterectomy is significantly decreased hospital stay. In minimally invasive hysterectomy for benign indications, same-day discharge has been accepted to be safe, cost-effective, and associated with high patient satisfaction. The applicability of these findings to gynecologic oncology patients who tend to be older with more comorbidities is less clear. While most studies examining discharge pattern in gynecologic oncology patients report an overnight admission, same-day discharge in this population has gained interest in the past several years. In a retrospective series of 696 patients undergoing minimally invasive hysterectomy for endometrial cancer over a 4-year period, Melamed et al. Found the rate of same-day discharge increased from 3.9 to 69.6%. 2 other studies have described association between same-day discharge and various factors, including surgery end time, use of intraoperative ketorolac, PACU pain scores, delayed PO intake, and robotic versus laparoscopic approach. These studies contained relatively heterogeneous populations. Operative factors that lead to successful same-day discharge and unplanned admission require further investigation. The primary objective of this study was to describe the discharge pattern in patients undergoing minimally invasive hysterectomy for endometrial cancer and complex atypical hyperplasia as part of our institutional quality improvement process. Secondary objectives were to analyze trends in same-day discharge utilization and reasons for unplanned admission, as well as the degree to which each factor contributes to successful same-day discharge. This was a retrospective study of patients undergoing laparoscopic or robotic hysterectomy for endometrial cancer and complex atypical hyperplasia between 2016 and 2019 at our institution. Patients operated on by 3 surgeons at our institution who routinely practice same-day discharge were included for consistency. 3 study groups were created: same-day discharge, or SDD, unplanned admission, UA, planned admission, PA. Demographic, perioperative factors, and encounters after discharge were compared. An exploratory multivariable logistic regression was performed. 262 patients were included. During the study period, 86 patients were planned for same-day discharge, and 66 of these patients successfully underwent same-day discharge. By year, the overall rate of planned same-day discharge increased from 1.9% to 52.9%, and discharge success among intended patients increased from 59.1% in 2017 to 82.5% in 2018. During the same period, 20 patients underwent unplanned admission, and 176 patients underwent planned admission. Patients who underwent same-day discharge compared to any admission shown in the far right column were younger, with median age of 62 compared to 66, and had a lower Charlson comorbidity index of 4 versus 5. These differences were negated when comparing same-day discharge with unplanned admission. BMI was not significantly different among all groups. While history of laparotomy or multiple surgeries were not significantly different, the same-day discharge group had the highest rate of prior laparoscopic surgery at 30.3% compared to 10% in unplanned admission and 11.7% in all admissions. In greater than 97% of cases, salpingo-oophorectomy was concurrently performed. 86.4% of same-day discharge patients underwent sentinel lymph node biopsy, and 4.5% had omental biopsy. Lymphadenectomy was associated with planned admission, but not unplanned admission. Adhesiolysis, regardless of degree, was not significantly different among all groups. Compared to all admission, same-day discharge was associated with shorter operative time, laparoscopic approach, and lower EBL. Similar findings were reflected compared with unplanned admission. That is, same-day discharge was associated with shorter operative time of 100.3 minutes versus 130.6 minutes in unplanned admission, and laparoscopic approach with 89.4% compared to 40% in robotic approach. Surgery end time was significantly later for all admission, but there was no difference between same-day discharge and unplanned admission. Intraoperative acetaminophen use was higher in the same-day discharge group compared with the combined admission group with 54.5% versus 34.2%. Intraoperative use of ketorolac was also higher in the same-day discharge group with 75.8% versus 51.5%. These were not significant between same-day discharge and unplanned admission. Postoperative pain scores were not significantly different between same-day discharge and unplanned admission groups, although this was the most common reason for unplanned admission. Other common reasons for admission included patient anxiety and anesthesia complications, such as altered mental status and respiratory changes. Median distance from home was not significantly different between same-day discharge and unplanned admission. The rate of readmission, emergency room or urgent care visits, and phone encounters within 30 days of discharge were not significant among all groups. An exploratory multivariable model was built. After adjusting for operative time, perioperative acetaminophen, and ketorolac, the odds of same-day discharge decreased by 4% with each 1-year increase in age. Similarly, each 1-minute increase in operative time decreased the odds of same-day discharge by 2%, with odds ratio of 0.98. Intraoperative acetaminophen and ketorolac remained predictive of same-day discharge, with odds ratio of 2.78 and 2.27, respectively. In our cohort of patients undergoing minimally invasive hysterectomy for endometrial cancer and complex atypical hyperplasia, we found that same-day discharge was associated with shorter operative time and laparoscopic approach. Our same-day discharge success rate of 82.5% is notable given our older average age of 62.2 years compared to 52 to 60 in literature, expanding the applicability of same-day discharge to this group. It appears that same-day discharge is safe. Strengths of our study include the comparatively large number of homogeneous cohort with the same pathology undergoing staging. We were able to account for comorbidities and quantify the impact of each factor in contributing to successful same-day discharge. Limitations of this study include the retrospective nature. By restricting the operating surgeons, we were able to maintain a relative consistency in practice patterns, but this may impact the generalizability. Although the study only spans 3 years, several immeasurable confounders exist, including individual surgical proficiency as well as changes in counseling as same-day discharge was more readily accepted. Our method of categorizing the patients may have underestimated the unplanned admission group, particularly if this decision was made intraoperatively. In conclusion, shorter operative time may be a useful selection criteria for determining candidacy for same-day discharge after minimally invasive hysterectomy for endometrial neoplasia. Discussions about same-day discharge preoperatively could improve rates of successful same-day discharge, since 25% of unplanned admission was due to patient anxiety. Given the high proportion of successful same-day discharge, coupled with low rates of complications and readmissions, surgeons should consider offering same-day discharge to a larger cohort of patients undergoing surgery for endometrial neoplasia. We believe that routine use of intraoperative acetaminophen and ketorolac should be encouraged. I would like to thank my co-authors and mentor. Thank you for your attention.